Talk Radio 640 WGST. Welcome to Health Tech Talk. This is where business, healthcare, and technology collide. Our host, Ben Chodor, interviews healthcare innovators and industry titans who are striving to make the world healthier with bleeding-edge human ingenuity. You'll hear it all on Health Tech Talk. Now, here's your host, Ben Chodor.
Good morning, good afternoon, good evening, wherever you are. I'm Ben Chodor, and you're listening to Health Tech Talk, broadcasting live from 640 WGST and streaming worldwide on the iHeartRadio network. And in my first segment, I have a special guest, Kevin Lasser. He is the CEO of JEMS Technology, an incredible telehealth company. And a little background on Kevin, he is a serial entrepreneur who has had many successes building bootstrap companies and leading them to successful exits. But today, we're here to talk about telehealth and JEMS Technology. And Kevin, you sound like a really, really busy man. Welcome to the show.
Oh, thank you, Ben. You know, I've listened to your broadcast. I love what you're doing. I think you're cut out for this work. I am absolutely honored to spend some time with you today.
Thank you so much. So tell me first, what is JEMS Technology, and why is telehealth so important?
Well, JEMS Technology is as you say, you know, we say we're a telehealth, telemedicine, virtual medicine company. It's sort of hard to box us in a group because we're very different from the other technologies and companies. What JEMS Technology does, and we've been doing for 5 years, and I'm very proud of, is we provide an expert's consult immediately, anywhere, anytime. And we do that on the mobile devices. And so we basically, what we set out to do, Ben, was to untether the professional, the expert on the one end, and be able to offer that healthcare consult to individuals anytime, anywhere, which includes EMS vehicles, homes, rural America, veterans, everybody, anywhere.
So let me ask you this. So with the baby boomers all turning 65, right, approximately what, I think 10,000 a day are turning 65, is your technology about keeping them connected to healthcare or keeping them connected to their providers?
Yeah, you know, that's a great point. You know, so baby boomers are turning 65 at a rate of 10,000 people a day. I'm one of those baby boomers, and that's for the next 19 years. So we know that the older you are, the greater chance you're going to be utilizing the healthcare system. So we're seeing that happen in an already overcrowded healthcare system. So there's more people that need doctors. There's fewer doctors per people, and certainly fewer experts per people. So what our technology does is it integrates that specialist with the person who needs them with immediacy.
So an example would be, so if I live in a rural area and there's not an incredible neurologist around where I am, your technology allows me to maybe get a world-class neurologist to do sort of consult with me remotely.
Absolutely. You know, there's over 60 million people who live in rural America. I should also point out, though, that our technology is used in some of the suburban areas as well that just need an expert. But with over 60 million people living in rural America, you know, you could go to your local hospital. You might have something in your shoulder. The doc that you're talking to, or the PA or the nurse you're talking to, is not a neurologist. That's a great example. And teleneurology has been used in telehealth for the last 10 years. That's something that we're doing, and it's proven to certainly save lives, period.
So Kevin, let me jump in here. So what is the technology behind it? Just so I can paint a picture for our audience at home. If I'm someone at home or someone at a location and I'm using the technology, what am I looking at, and what is the physician or the clinician on the other side seeing?
Sure. So great question. So if you were to go, say, to a hospital and they want to get you in front of a neurologist, there's really three form factors that we have. One is a cart, you know, the carts that you see inside hospitals. That's what we would call our facility model. So they would pull that facility model, our cart, what we call a mobile system, to the patient. And then within 30 seconds, they would have live streaming video of that patient to a specialist.
So there's two-way video involved, right? So me as the clinician, I get to see my patient. I get to hear him. So I get to sort of do a visual examination of him. And is there anything else? Do I get any vitals? Do I get any other information? Or is it more about just the visual and audio consultation?
anything with streaming video. So there's people who use otoscopes, stethoscopes, laryngoscopes, dermoscopes, anything, and EKGs. So anything that has streaming video has been sent through, can be and has been sent through the JEMS unit. So really, if it's a cardiologist and the cardiologist, say, is 300 miles away, they would say, all right, well, give me, I want to see the EKG. So the person with the patient would then show them the view from the EKG, and that would be streamed directly to their smart device securely, of course. We are HIPAA compliant.
So this is what we're talking about. So we're listening to Health Tech Talk, right? So everyone's listening, and it's all about the collision of technology and healthcare. And JEMS technology is the ideal technology for my show, right? So you've taken technology, you've added with healthcare, you've made it clinical. As we were saying, as a cardiologist, I will be able to instantly get the EKG, see my patient's eyes, talk to them about what they're feeling, add other clinical elements to it as well, and actually probably be able to make a diagnosis or at least tell the patient what to do next. This is really incredible.
No, thanks, Ben. Like I said, when we started this 5 years ago, we were looking at what was available in the industry, and, the standard telemedicine was, somebody wants to see a dermatologist, perhaps they live in a rural area, and they set up an appointment to see a dermatologist. So they set up an appointment at their healthcare facility. They go to an audiovisual room, and that audiovisual room beams to a dermatologist, say 200, 300 miles away. That's how typical telemedicine, it's a set appointment. The solution, we didn't start a technology company just to start a technology company. There was a problem. The problem was, what if there's a serious immediate need for a dermatologist?
Right. Okay.
Some horrible event occurs where, right, you need a dermatologist, the doctor is not a dermatologist. Well, that doctor then could immediately get that right dermatologist.
The ability to have an instant consultation anytime I need it, anywhere I need it, to make, decisions. I mean, I think that's incredible. I mean, and it's about time. So it basically breaks the walls. And then, so internationally, so let's talk. We talked a little about the U.S., but so this technology can be used anywhere. So you could do it. I understand you're working in China, so you get to bring the world together.
Yeah, I appreciate that. Yeah, we have some success in China, and you could imagine China. There's some very rural parts of China where we're delivering healthcare to rural China with specialists in Shanghai. That's the doctors typically don't live in the rural areas. In China, they live in the more populated Beijing, Shanghai, places like
Kevin,
that.
I got to interrupt because we're almost at our commercial break, but I want to ask you one last question before we go to commercial break. What kind of technology is behind it? So are we using the public internet? How are we transporting the information?
Well, we can use we're data agnostic, Ben. Okay. That's one thing that makes us stand out, I believe. So we use Wi-Fi, 3G, 4G, 5G, 2G, as well as satellite. We're testing on some submarines.
We're going to come back to the submarines when we come back from this commercial. I need to cut to commercial break. I want to just give a special thanks to 1-800 Public Relations for all their PR and media support, and also to Stream BPG for allowing us the production capabilities. And we'll be right back after this commercial break. Thank you very much. And you're listening to Health Tech Talk.
Guys, if you've been using or wanting to try Viagra but are worried about the costs, we have great news. Now you can finally get real results at huge discounts with our Healthy Man alternative to the little blue pill. Why pay U.S. pharmacy prices of $15 per pill or more when you can get results for a fraction of the price? Call today and get 40 pills for only $99. Others cost as much as $600 at your local pharmacy. You can't afford not to call us if you want real results at the lowest prices. Never pay $15 a pill for Viagra when you can get real results for less than $3 per pill. Call 800-539-8159 today and save over $500. You can have those breathtaking, toe-curling moments again and again. Healthy Man is fast, easy, and affordable. Call right now and we'll rush you your supply delivered discreetly to your door. Just call 800-539-8159. That's 800-539-8159. Again, 800-539-8159.
If you need to lose 30 pounds or more more? Please listen carefully. Research by world-renowned scientists proves that carrying fat in your midsection raises your risk of heart disease, high blood pressure, even a stroke. If you need to lose at least 30 pounds, we're inviting you to participate in a limited release of a groundbreaking weight loss supplement called Neoline Plus. To participate in this risk-free trial and lose weight now, call this toll-free number in the next 5 minutes. 1-800-600-4902. Neoline Plus can mean the difference between a failed diet and a weight loss success story. Please lose weight with Neoline Plus responsibly and take no more than 2 capsules once a day. For your participation, you'll be given a full-size supply to use absolutely risk-free. Participation is strictly limited. Only call if you need to lose weight for legitimate reasons. To lose weight now and participate in this risk-free trial of Neoline Plus, call toll-free 1-800-600-4902. Phone lines will be open for the next 5 minutes. 1-800-600-4902.
This is a special notice to consumers who owe back taxes to the IRS. Due to the financial hardship consumers are facing during the decline in the U.S. economy, the Internal Revenue Service has made it easier to settle delinquent tax problems. In some cases, this may even result in back taxes being reduced. An open phone line has been established by National Tax Relief for consumers to call and see if they qualify. To ensure your financial stability during this decline in the economy, take down this number, 800-832-9615. That's 800-832-9615. If you owe back taxes to the IRS and can't afford to pay them back, there's no need to fear anymore. You may qualify for a program that could settle your delinquent tax problems and in some cases save you money. For your free information and to see if you qualify, call National Tax Relief at 800-832-9615. That's 800-832-9615. 800-832-9615.
This is Jeff Foxworthy. When I was growing up, I had heroes like Batman, Spider-Man, and any man scooping ice cream. Today, my hero is an organization called Cure Childhood Cancer. They are doing all kinds of heroic things that you should know about. The moment a child is diagnosed with cancer, Cure joins the devastated family and stays with that family throughout their frightening journey, however long or bad, providing guidance, compassion, and whatever help that family needs. And that relationship is forever. Cure works year in and year out to provide badly needed funding for the specialized research required for childhood cancer. This critical funding is working, folks. We are getting closer to eliminating this dreaded disease in our lifetime. You see, Cure would never use the word hero. They'd use the word help. Please help Cure save children's lives. Believe me, you'll be a hero too. Donate at curechildhoodcancer.org.
At iHeartRadio, we love discovering new songs. We love going to shows, finding new artists and new talent to share. What we're trying to say is we're musically obsessed. To feed that obsession, we've linked up thousands of live radio stations from around the world and a library of over 20 million songs from over 800,000 artists, all put together by real music fans. There's something here for everyone. Millions of songs, thousands of stations, one free app. iHeartRadio makes it that easy. Download the iHeartRadio app now or listen online at iHeartRadio.com.
Hi, this is Gordon Deal. Join me weekday mornings at 7 for America's First News on Talk Radio 640 WGST.
Welcome back, and if you're just turning in, you're listening to Health Tech Talk, broadcasting from iHeart Studios at Atlanta's 640 WGST and streaming worldwide on the iHeart Radio Network. And with me is Kevin Lasser. He's the CEO of JEMS Technology. And before we took our break, we were talking a little bit about the uses of this technology for telehealth, and we were just touching on, you were saying it's been used on submarines. Let me get this straight. I understand that if I'm in a rural location, I understand if I'm in another country and I need to talk to a clinician using your technology, they get to see me, they get to see my vitals and hear what's going on. But you're telling me I could be under the sea and I could be using JEMS technology? So if someone's sick on a submarine?
Yep, satellite. So once again, data agnostic. So 3G, 4G, 5G, 2G, Wi-Fi, satellite. The JEMS technology, the way it was designed by my brilliant partner, Amy Phillips, is designed to be data agnostic. So you don't really choose. The machine, our technology would choose the data that is best for it, and then it goes forward. So it's invisible to the person using the technology.
It's just turn it on and it's ready to go. JEMS technology is taking care of all the issues or all the technology behind it.
We are, and thanks for saying that. We are we truly are a turnkey technology. A lot of these technologies, there's a cost for the technology, and then, these healthcare systems have to invest a substantial amount in their Wi-Fi systems. There's a lot more to it. JEMS is truly turnkey.
I kind of also love about JEMS technology is that you're not just a telehealth company. Which I mean by that is you're not just a company who's monitoring people from their home, or they're going into just a room at a hospital to communicate to a clinician. You are truly a virtual organization. Your technology could be used on EMT trucks. It could be used, as we said, on submarines. It could be used, in other countries. There's no barriers. There's no walls.
No, there's not. And, so I just got back from Sault Ste. Marie, Michigan. Great area in the eastern Upper Peninsula where we're working with Dr. Michael Everett. He's program director for EMS paramedicine at Lake State, and Dr. Chris Mason. He's the medical director at War Memorial, and they're developing with our technology a community paramedic integrated health program. And really, it sounds like, white paper on accountable care organizations, but it's to decrease healthcare costs, increase patient safety and satisfaction, and minimize concerns. The concerns such as readmissions, hospital-acquired infections, all these types of things. And you know what, Ben, I think the coolest thing is I think it speaks to what an innovative, cool technology JEMS is based on the innovative, cool technology leaders, healthcare leaders that we're working with. And I'm very, very proud of that. There's Paula Morning. Paula is the ALSA director in Michigan. ALS is a horrible disease.
Yes,
it's also known as Lou Gehrig's disease, but she wanted a way for her patients in northern parts of Michigan to not have to drive hundreds of miles to see the ALS neurologist that they have to see. So they see them virtually. They drive a much shorter distance, and they see them virtually using our technology. And Paula Mooring is, somebody who I would call an absolute godsend for people with ALS.
So Kevin, I want to interrupt. So this isn't just, all right, so I'm learning as we go, which is great. So a host of Health Tech Talk is learning as we go. This isn't just so me as a clinician, if I was a clinician, can do a diagnostic on a patient, and so a patient can stay in touch with their doctor. But this is also incredible technology. As a clinician, I can't have my patients constantly come in. A lot of them have mobility problems. It's a way for me to be able to virtually check in on my patients whenever I need to. So, in fact, building a better patient engagement, which is one of the key things going on in healthcare right now. It's not just about treating someone when they're sick, but creating better healthcare engagement. And your technology enables that. Am I in the right track?
Yeah, absolutely. And I appreciate your kind words. And it's humbling. I'm just a kid from Southfield, Michigan, who got really bad grades in science.
And you built several technology companies. Go figure.
Well, yeah, there you go.
So let me shift a little bit to the business side, right? Because our audience is made up, of obviously consumers. It's made up of investors, a lot of investors. We have a big investor community listening to the show.
Sure.
And then, of course, we have a big healthcare community listening to the show. So one question I got is, how does JEMS technology make money?
Okay. Well, we sell the technology, and then there's an annual licensing fee as well. It's a very simple model, but it's a very lucrative model as well. Our clients tell us that they really like our model, and this is what we pay for the technology, and this is what the annual maintenance fee is. So it's very simple from the client perspective, and like I said, very lucrative from our perspective. We have a lot of happy customers, and quite frankly, we get quite a few referrals.
So how do you go about marketing the company?
You know something? I speak at various seminars throughout the country. I'm an inaugural committee member of Mobile HIMSS, HIMSS. We do business with a group purchasing organization called the Marinette. I travel the country speaking on behalf of reimbursement. The fact that reimbursement is a key. Honestly, when we started the company 5 years ago, people were not really getting reimbursed for telemedicine. Right. Nothing like it is today.
So, Kevin, do you attend conferences like the ATA, the American Telemedicine Association conference that they have each year? And tied in with that, as you were saying, so reimbursement, has totally changed the business of telehealth.
Oh, absolutely. You know, I'm famous for saying this, Ben. I say it's not the money, it's the money. So you have to be paid. You know, you can't expect, you know, the healthcare providers, they have to make money. They have to keep their doors open.
That's right.
And now that they're being reimbursed for all sorts of codes.
Right.
And it's very easy. We actually have somebody on our staff who walks people through the different coding and how they can be reimbursed for it.
I don't think anyone would fight knowing that I can be reimbursed for it. And that's all the physicians have ever wanted. All the providers, that's all they've ever wanted. And they all believe in the whole world of telehealth. It's just, how do I reimburse or how do I pay a physician if he's going to spend 30 minutes with a patient remotely? And your technology and you helping them figure out what the codes are sort of enables us to not only increase our revenue, but also save costs in healthcare.
Absolutely.
So Kevin, another thing I read in your bio is that you're all about sort of the lean bootstrap startup. You built a couple companies and had successful exits. What does that mean? How long have you been doing that? And what advice would you give to our audience that's trying to start a business? Why bootstrap it as opposed to trying to raise lots of money to begin with?
Well, so, you know, I've always started a company to solve a problem, not to sell it. I've never started a company to sell it. You know, I say, hey, if we sell it, great. But I start companies because...
Well, Kevin, if I could interrupt too, I think one of the keys is I have a good friend named Nick Spring, and one of his comments that he always says is companies, you don't build a company to sell. Someone finds your company and buys it. That's what happens.
Absolutely.
Yeah.
Absolutely. And, you know, so, you know, my goal is never to sell any company, and we've had some success. My goal is to build a company, start a company that is solving a problem. JEMS solves a big problem, and we continue to solve that problem. And we're even going outside of healthcare now. We have teleengineering. People are using our technology in Africa rather than fly the right engineer all over Africa to diagnose what's happening in a plant. They're sending that to the comfort of their home on their mobile devices. So in reality, your technology could be used in any medium. I mean, healthcare is obviously the area that's needed most. There's a great payoff for it, and health is really important. But if I'm a Home Depot and I want to help someone build a deck or put their grill together, this is incredible technology for it as well. Yeah, you could do that. Of course, you know, you have to have a need for security,
right? Because
everything with our technology is secure, which is how we're able to do business. We're in various federal agencies, Department of Homeland Security, the VA, Department of Justice, because it's a very secure program. So I'm not sure the Home Depot would have a need for security, but the people we're working with in Africa absolutely have a need for security, and that's what JEMS is. JEMS is, you know, I like to say that JEMS is Skype on steroids, right?
Which is an incredible way to look at it. So what do we expect to see from JEMS over the next 6 and 12 months? Excite my audience. Tell us what's next for JEMS.
You know, we're breaking the mold, right? So, you know, I talked about tele-ALS, right?
Yep.
Talked about the different places. Look, teleneurology is fantastic. Telepsychiatry is fantastic. We're going outside of that. One really cool thing is what I would call tele-OR, and it was really the CEO of a company called Quipsor, Mike Weber, contacted me and said, you know, he used to be a medical rep, and he said there's too many medical reps inside the OR, and there's this thing called health-acquired conditions, HAC, and the goal of it's the old saying, the hospital's a good place to get sick, right? So he said, I need to provide a virtual sales rep. It's good to have the sales rep there, but they don't have to be there physically.
You are exactly right, Kevin. But I got to interrupt you because I'm running out of time, but I want to make sure the audience knows how to get in touch with you. Please tell everyone how they get in touch with JEMS Technology.
Please email me directly. It's Lasser, Lasser, Klasser at gemstech.com. Let me spell that. That's JEMSTECH.com, gemstech.com. be delighted to hear from your listeners.
Thank you, Kevin. I need to cut to commercial. I want to thank 1-800 Public Relations for all their PR and media support. And you're listening to Health Tech Talk on WGST iHeartRadio.